Hi, welcome to this video on OET Reading Part B. OET Reading Part B. This is seemingly straightforward with shorter texts which are 100 to 150 words long, and you have multiple choice questions with 3 options when compared to Part C where you have longer texts with around 800 words and questions, multiple choice questions again with 4 different options. So students might feel that they just have to read shorter texts and they have only fewer options to decide from. But students who have been practicing regularly OET Reading Part B would have understood the challenges associated with Part B. Now, in this video, we are going to try out a method which I personally feel would be more effective. That is, here we are not going to look at the questions and options initially. First, we'll read the text and then go back to the question and options. Now, as you all know, the kind of text that we have in Part B of reading are short workplace extracts, which can be memos, emails, notices, policies, guidelines, and so on. So, the advantage what I feel when you follow this approach is that when you're reading this text without any preconceived notion, which you get by reading the question or the options, you have better understanding. You try to understand it all by yourself without any inclination towards any specific words that you have noticed in the questions or the options. It's as simple as, let me put it in this way. Now, if you're going to meet a person for the first time, you have no idea regarding the person. Now, if you're going to make a judgment about that person, it's all based on the interaction that you have with that person. But at the same time, before meeting that person, if you happen to hear about that person from somebody else, maybe you might have a chance to get influenced by their ideas. So I look at it that way. Now, let's try this approach for a couple of questions and see how it works. Now, you can see on the screen the first extract. I'm not going to show you the question or the options. Just read the extract and let's try to find out what it is all about. It says, right patient, right blood assessments. We doesn't know whether this is a policy or guideline or anything. Let's start reading it anyways. Right patient, right blood assessments. The administration of blood can have significant morbidity and mortality. They're saying an effect or how critical this blood administration or blood transfusion is. Then following the introduction of right patient, right blood safety policy. Okay, so we understand that this is a policy. So following the introduction of this right patient, right blood safety policy, all staff involved in the transfusion process must be competency assessed. So they are talking about the need for competency assessment of the staff involved in this blood transfusion. Competency assessment means that they need to ensure that they're competent enough, that they're skilled enough, they have the necessary skill and knowledge to do this blood transfusion. That is what this policy highlights, or what is this policy ensures. To ensure the safe administration of blood components to the intended patient, all staff must be aware of their responsibilities in line with the professional standards. Again, they are saying that anybody who's involved in this blood transfusion should be aware of what their responsibilities are, along with or which is matching with the professional standards. Now, moving on to the second para. What does it say? Staff must ensure that if they take any part in the transfusion process, their competency assessment is, again, they're talking about the competency assessment, is updated every 3 years. So again, they're signifying this, the need for competency assessment. In the first paragraph, they've already mentioned that they should be, anybody who's taking part in this blood transfusion should be competency assessed. And in this paragraph, they're saying that this competency assessment, that is the evaluation of their competency, should be done, or it should be updated every 3 years. Then all staff are responsible for ensuring that they attend the mandatory training identified for their roles. So they also say that anybody or all the staff who are involved in this blood transfusion should ensure that they attend a training program which is mandatory, associated or identified, which is matching their profile, which is matching their role. Relevant training courses are clearly identified in Appendix 1 of the mandatory training matrix. So what do we understand from this paragraph or from this text? So this talks about, initially the first line talks about the how critical the blood transfusion is. That is, it can lead to morbidity and mortality. In just one line they have mentioned that. Then the entire focus is on the competency assessment of the staff who will be involved in this blood transfusion. So what are the things that they say as per this policy? As a part of this right patient, right blood safety policy, it ensures that all the staff involved in this blood transfusion should be attending this competency assessment, and this competency assessment should be updated every 3 years. You have to make sure that anybody who's taking part in this blood transfusion process, that is any healthcare professional, a staff that is involved in this blood transfusion, must ensure that they have undergone their competency assessment, and this competency assessment is done or updated every 3 years. That is one requirement. And another thing what they say is that they should be attending a training program, a mandatory training program identified for their roles. So for every role there would be a mandatory training program, and the staff should also have undergone that training program in order to be involved in this blood transfusion. So these are the main ideas that we get from this policy, this right patient, right blood safety policy. Now let's see the question and the options. Now what does the question say? What must all staff involved in the transfusion process do? So as per the passage or as per the text, what is it that all the staff those who are involved in this blood transfusion must be doing? Now, what did we identify? Without looking the options, what did we identify? That they should have done their competency assessment, and which needs to be updated every 3 years, and also they should have undergone this mandatory training program. Right? These are the two things that we have identified as which should be done by the staff. Now, let's go through the options. The first option A says that check that their existing training is valid. Existing training is valid. So in the passage, did we notice anything about validity? Now, there's an exact reference to validity as such, but here it is said that their competency assessment is updated every 3 years, which can mean that, like, if it is, once it turns out to be invalid after 3 years, it has to be updated again. So we can take that meaning, but let's not confirm it. Let's put that on hold. Now let us look at option B. What does option B say? Attend a course to learn about new procedures. Attend a course to learn about new procedures. Did they mention anything about learning new procedures in the text? No. It's only mentioned that they have to attend mandatory training program identified for their roles. For each role, there would be a specific training program, and the staff need to undergo that training program. But they have not talked about learning new procedures, which means that this idea is not given. And for that reason, we can eliminate this option. And what about option C? Read a document that explains changes in policy. Is there a reference about any such document mentioning about changes in policy? They've nowhere mentioned about any document or changes in policy. So this is also not given. For that reason, we can eliminate option C as well. So if B and C are eliminated, naturally A would be the answer. So we can consider it as an elimination method, which is in fact an effective method for concluding the right answer when it comes to multiple choice questions. When you are not able to rightly spot on the correct answer, what you should be trying is that we should try to eliminate the incorrect options so that we are just left out with one option. Therefore, we can conclude that that is the right answer. Here, if you see, now let me tell you, if we had gone for a word-to-word match, or if you try to match the keywords in the question and the options to a synonym of the same in the text, we would be failing in that attempt here, because we cannot find a word as valid, or we cannot find a synonym of valid anywhere in the text. But once we understand that idea, it becomes easier for us to get related to that option. And not just that, if that is not possible, we can go for the elimination also. In this case, we can easily eliminate options B and C because we have a clear understanding after reading the passage, after reading the text, that they have not mentioned about learning any new procedures, or no, they have not mentioned about reading any document that explains about changes in policy. So we can quickly eliminate B and C. Therefore, jumping it to the right answer as option A. Hope that is clear. Now let's see one more example. Here also I'm not showing the question and the options. Let's get straight into the text. It's given to and subject. So probably this has got to be an email to all staff, and the subject is regarding the use of bed rails. Now what does it say? Please note the following. Patients in hospitals may be at risk of falling from bed for many reasons, including poor mobility, dementia, delirium, visual impairment, and the effects of treatment or medication. Bed rails can be used as safety devices intended to reduce risk. So in the first paragraph, what they talk about is patients can have fall from bed while in hospital due to multiple reasons. Multiple reasons have been presented here. And then they have added on by saying that as a safety measure or as a safety device, bed rails can be used to reduce the risk of falling from bed in hospitals. Now moving on to the second paragraph. It starts off with a contradictory or a contrasting connector. However, now what did the previous statement or the previous sentence say? Bed rails can be used as safety devices intended to reduce risk. And then they say, however, which means that they're going to say some shortcoming or a limitation of bed rails. They have already said about a positive aspect that it can be used as a safety device. Then they are saying, however. Now, however means we have to understand that now there is a change in idea. They're going to shift to a negative aspect or probably a limitation of this bed rails. What it is mentioned here, bed rails aren't appropriate for all patients, which means that bed rails are not appropriate for all patients. It cannot just blindly or randomly used for any patient, and their use involves risks. So the two problems which they say here, initially they have said that it can be used as safety devices. However, the problem is that it cannot be applied or it cannot be used for all patients, and their use involves risks as well. That's why they have used this contradictory connector, however. Okay, we understand up to that much. Then what is said? National data suggests around 1,250 patients injure themselves on bed rails annually. So that is the risk that they have talked about. As per the statistics, around 1,250 patients injure themselves by on bed rails, usually scrapes and bruises to their lower legs. So the kind of injuries or the kind of risk involved is that through this bed rail, it can cause or it can result in scrapes or bruises being formed on the patient's lower legs. Then statistics show 44,000 reports of patient falls from bed annually, resulting in 11 deaths. So this statistics, what they say is the number of deaths per year as a result of fall from beds, which means that without the use of bed rails, because of fall from beds, how many deaths occur or happen in hospitals because of this patient's fall from bed. The statistics say that annually it results in about 11 deaths, while deaths due to bed rail entrapment occurs less than 1 every 2 years. So here they have made a comparison. That is, as per the statistics, the number of deaths annually because of fall from bed in hospitals, when it is 11 deaths annually, deaths due to bed rail entrapment because of the patient being entrapped in bed rail occurs less than 1 in every 2 years. So you just see the difference there. When one is 11 deaths annually, when it comes to bed rail entrapment, it is less than 1 every 2 years. And are avoidable if the relevant advice is followed. And it's also said that already the number is very less when it comes to bed rail entrapment. And even that can be avoided if relevant advice is followed. Which means that from this comparison, we are to understand that even though risks are involved with the use of bed rails, as per statistics, it is clear that the number of deaths that result from fall from bed is much higher than which is caused due to bed rail entrapment. Then what is said? Staff should continue to take great care to avoid bed rail entrapment. Okay, staff should be careful to ensure that patients are not involved or did not get involved in this bed rail entrapment. But be aware that in hospital settings, there may be a greater risk of harm to patients who fall out of bed. again, they're concluding by saying that, okay, the staff should be careful to ensure that patients are not involved in this bed rail entrapment. But even then, they're saying that it should be the staff should be aware of the fact that in a hospital setting, the greater risk that is posed to a patient comes from fall from bed. So that is the conclusion. Now, what is the general idea that we get after reading this extract from the email? Here they are talking about the use of bed rail as a safety device. They say that this bed rail has some shortcomings as well, that this certain risks are associated with the use of bed rails. But what they say is that when they look at the statistics, the deaths that are caused because of fall from beds is much higher than the deaths that are caused due to bed rail entrapment. And they say that the staff should be careful to avoid bed rail entrapment, but at the same time, they need to be aware that greater risks of harm to patients come from fall out of bed. That is what we have understood. Now let's look at the question and the options. The email is reminding the staff. The email is reminding the staff. Okay, now when the question is the email is reminding the staff, here they want to know the summary or what is the main idea of the email. What is the intention of this email? What is option A says? It's a kind of completion question. That is, when you have completion questions, always try to read the question, the stem part along with the option, so that you get a complete idea of how that option is going to fit with the question. So if you're choosing A, option A says that the email is reminding staff that the benefits to patients of using bed rails can outweigh the dangers. Outweigh means it can be more, or it is more significant than the dangers caused by bed rails. So option A says that it is reminding the staff that the benefits that the patient gets by using the bed rails is much higher than the dangers that are caused by bed rails. So that is one idea which you've just seen now. From the statistics, it was clear that the number of deaths caused due to bed rail entrapment is much less, or it's very less or even negligible, we can say, when compared to the deaths caused by fall from beds. So this can be actually a potential right answer. Let's put it on hold. Let's not conclude. We need to go through the other options as well. What does option B say? B says that number of bed rail. Okay, let's read it together. The question plus the option. The email is reminding staff that the number of bed rail related accidents has reached unacceptable levels. Has it reached unacceptable levels? No, it's actually contradicting what is given in the email. As per the email, it says that the number of deaths caused because of this bed rail entrapment is very less, that it's less than 1 in every 2 years. So this is actually contradicting. And for that reason, we can eliminate option B. And now what about option C? Option C says that the email is reminding staff that the patient's condition should be central. Patient's condition should be central to any decision about the use of bed rails. Now, this can be quite confusing because you would have noticed a statement made in the email that bed rails cannot be. They have said that bed rails can be used as a safety device, but it is also said here that, see, however, bed rails aren't appropriate for all patients. So this can actually be confusing. So students might have this tendency, why not C? Patient's condition should be central to any decision about the use of bed rails. Now, the idea that as per option C, patient's condition should be central to any decision about the use of bed rails, I cannot say that it is wrong. The idea is not wrong. It is actually mentioned that that patient's condition is, of course, a deciding factor when coming to the use of bed rails. It cannot be, or bed rails cannot be used for all patients. It is mentioned in the email that it's not appropriate for all patients. But what is the question here? The email is reminding the staff. So we have to go for the central idea, or I would say the main takeaway from that email. So is the central idea or the main focus of the email that the patient's condition is the deciding factor, the patient's condition should be the deciding factor for the use of bed rails? No. They've just mentioned it that it's not appropriate to be used for all patients. But at the same time, if the following paragraph, for instance, let me show you. If in this paragraph, if they have elaborated on this idea, under what circumstances this bed rails cannot be used. For instance, if the patient is frail, or if the patient is aggressive or agitated, then if the patient has disorientation, in such situations, the bed rails cannot be used. And if the explanation of the second paragraph was based on the patient's condition, specifically stating that what should be done or how should the bed rail be used under such circumstances, or where bed rails cannot be used at all, then of course we could have chosen option C as the right answer. But in the given text, the highlight is all about the comparison between the risks involved with using bed rails and without using bed rails. So definitely for that reason, we can conclude that option A is the right answer, which says that the benefits to patients of using bed rails can outweigh, which is much more than the dangers involved with using bed rails. So I hope by now you would have got an idea on how this approach works. So I would not claim that this is a one-stop solution for all. But I personally vouch for this method, because if you approach the passage, or if you approach the text without any preconceived notion, without reading the questions or the options, you have a chance to understand the passage in a better way, and you will be unbiased and you can reach at the answers more appropriately or more accurately. So I hope you found this video helpful. We'll be back with more such videos. Stay tuned. Thank you.
MedCity International Academy. Trusted hands forever.